And hi, everyone. Thank you for joining us for 15 minutes. I'm Andrew Huff. My guest today is the recently appointed director for the Department of Public Health for Seattle and King County, Patty Hayes. Patty, thank you for being with us today.
Thanks so much.
And congratulations for your recent appointment to the department, although you have been interim director for about the last 8 months or so.
That's right.
And before that, you headed one of the largest divisions in the department as well. So you're no stranger to these parts, I would imagine.
That's right. I came into the county for the Community Health Service Division. That's the largest division. It runs the clinic system, the healthcare for the homeless, our outreach and access work that did such a great job with healthcare reform. So it's been a joy being with public health.
So you're probably going to be able to hit the ground running in this new position that you've had for a while.
It feels like
imagine.
that, yeah.
You have over 25 years or so experience in the area of public health. You work for a nonprofit, you work for the state for a while. In terms of this department, are there going to be any structural changes in a policy direction that you anticipate in the next 6 months or a year or so? What can we expect for the department now that you're officially the head of that department?
Well, we're going to continue the work we actually started when I stepped in, and that's really about working with our whole system of public health and healthcare to define how in the transformation that's happening in the healthcare system and in government actually, what's the best role for public health. So we are working very closely with DCHS and with our partners in the community to really look at where we need to be using our great data, our great services, and how do we align that together. I think one of the challenges for people is they don't know what public health does. So we're trying to make sure that we are making our services visible and engaging in the community.
Give us a 10-second synopsis of the role of the Department of Public Health, if you could.
Well, public health is all about prevention and helping folks live the healthiest lives they can in their community. So that can stem from working with community-based organizations and how to build safe routes to schools, to our immunization work, to our maternal child health work, to our environmental health work. And so it stems from birth all the way through a person's life.
You mentioned that the overall mission of the department is prevention, tracking and preventing disease and other threats, making sure that we have a safe work environment, limiting workplace exposures. What do you think is the biggest challenge that you expect to run into? Is it always come down to funding, or what is it?
Well, actually, it's the role of public health within what we need and that people expect in their local communities. Funding is always a piece of that because you can't do that work if you don't have the base funding. And that's been the tension in public health over the last number of years as funding's been flattened or we've lost funding. But our base challenge really is how do we make sure as all the challenges come forward with climate change, with the changes in moving towards a more prevention agenda, how do we help and be the catalyst for that prevention agenda?
Is a lot of that community outreach, getting that information out there to the public?
Yes, well, it's both to the public and helping empower our partners to be able to get the right information out. For example, when we're working on something like the Ebola scare that happened, and that's still an issue. We are working with the whole hospital system, with our community partners, and in messaging to our partners like the Somali community, so that they know what we need to do, how we're protecting people. When volunteers come back from Sierra Leone and need to be monitored, we're doing that and helping them out so that we're keeping the community safe. That's often not discussed unless there's a big issue, but that's the quiet but very important work that we do.
Let me ask you something. Bad habits such as smoking has been greatly reduced over the last 25, 30 years or so. And I think people simply pay more attention to what they eat and have more information about the food that they consume. Would you say that we are a healthier society than we were, say, 25 years ago?
That's a great question. I think that we are working on making the opportunity for people to be healthier. But there's a lot behind that. When we look at King County in general, we are one of the healthiest counties, if you look at the general statistics. It's a great place to live, it's a great place to work. We have a lot of resources here. But when we look at the opportunities across the spectrum in communities of color, those opportunities aren't the same. And so just a messaging around healthy eating, if you don't have access to healthy food, or if, for example, maybe you don't even have a grocery store in your neighborhood, or you are working so hard with multiple jobs that it's hard to even know how to stop and make a healthy meal for your family, or those meals that are more for your culture aren't available to you. Those can be incredible challenges. And then when you add poverty on top of it, we really have a challenge in helping support communities to be able to have what so many of us have as a availability here in the county.
Communities in rural areas that maybe don't have the same access to health care that maybe others do.
Well, rural areas are one, but actually we have, particularly in South King County and some of the areas in the Seattle area, are just food deserts, we'll call them. They don't have access to healthy foods. We've been getting some federal grants to work on that. We've been working with the division, other divisions, and with DNRP on their work around how do we do farm-to-table work. So there's just a lot of exciting things that can happen, but you got to pay attention to where the needs are and where we need to be working.
Patty, before you worked for the Department of Health, you worked for the State Department of Health, in various positions, including Assistant Secretary of Health for Community and Family Health, as well as the Director of the Legislative Policy Constituent Relations. In terms of the state, do you think the state legislature is adequately funding efforts in public health, or do we need more?
Well, I think it's pretty clear that they're not. What's been happening over the last number of years is the legislature has been struggling through the bad economy on how to take the state resources and put them out. They've worked to try and stabilize some funding that public health had over time, but that doesn't keep up with even inflation. So the challenges we've got, our legislative delegation and our council members have been really great in looking at, particularly when I walked in, and really made it very transparent what we need to be doing in public health. I think it's clear we need to be working on that. We're actually trying to work on that as a statewide network of public health.
You had mentioned some global health issues before. We have, as you know, a group or an organization such as the Bill and Melinda Gates Foundation, which has put vast amount of resources and done some wonderful work on a global scale. What impact do you think the Bill and Melinda Gates Foundation has had in the area of global health?
Oh, it's tremendous. And I'm delighted to say they are a great partner here. I've done a number of projects with the foundation, and it's amazing to have a foundation partner. We're also doing some really creative work with the Seattle Foundation right now. So philanthropy is just an amazing leverage and can really help look at issues from a whole different lens. It's really great to work with them.
A bit of some personal information. You were born in California.
Yeah.
I understand that you grew up next to Disneyland when it first opened. Is that right? I've heard from some sources that I have, because I have sources everywhere.
You do, yes.
And grew up near Disneyland when it first opened.
That's right. So you're outing me on how old I am. Thank you so much. So
that wasn't my intent.
All right. Well, that's okay. That's okay. I own it proudly. I grew up very near Disneyland until I was at the age of 5. I have a Mickey Mouse watch, actually. That's quite enormous. And
sure
yes,
is.
that's part of my branding, because I've worked all my career with moms and kids, and so even my office is very entertaining. It's very child-friendly, and so I've carried that inner child with me all my life.
Good for you. I hope you never give that up. One of my other sources said that you were influenced to become a nurse by the Patty Duke Show.
I was.
And for those of you that are under a certain age, the Patty Duke Show was a show that ran in the 1960s about a vivacious teenager, Patty Duke, who also was a candy striper on the show. Is that one of your main is that true?
Yeah,
that Patty Duke was one of your main influences.
She was. So I watched that as a teenager, and it inspired me to volunteer at the local hospital. And I found my inner passion to help people, and then got interested because of the great mentors I had. And it was in Longview, that's where I was, at the hospital down there, to go to nursing school.
Okay. So, since you did watch the Patty Duke Show, let me ask you a trivia question.
Oh my gosh,
Can
you're
you
kidding
tell me which of these celebrities appeared on the Patty Duke Show? Frank Sinatra Jr., Sammy Davis Jr., or Frankie Avalon? Which
it was
one
Frankie
appeared?
Avalon, wasn't it? No.
You are partially correct. All three.
All three?
It was a trick question, all in
man,
1965.
That is a trick question.
One of your hobbies, and tell me if this is true, is astrophysics and quantum mechanics. Is that true?
Yeah, I'm very interested in that and in astronomy.
What led you to become interested in science? Is that something you just had a natural affinity for?
Well, going into nursing, it is a science-based education, and even in high school, I loved science. But the mystery of quantum work, the whole look at how the universe works, and the neutrinos that are flying around us right now, it really gives me a larger view. It helps me think about organizations in a different way, knowing that there's so much more that we can't really see. So it's really that mystery that helps keep me grounded and thinking creatively, actually.
In the next 12 months of the Department of Health, what can we expect to see in terms of any changes, in terms of any new direction? What can we expect to see at your department?
So what you're going to see is that we're working very hard right now on our financial issues. Those didn't go away when I took over. There was bridge funding, and we still have a large deficit and debt. So we're working to really shape up all our financial pieces, and to work with the council and the county exec. I'm working very hard for him on the Best Starts for Kids levy. That levy will help to stabilize the maternal child health, very important work that we do. In addition, I'm going to be working to fill we have lots of interim positions, and we'll be working to fill those positions to stabilize our leadership. I'm going to be working very hard on our workforce to really get the leadership that we need, and then with our community partners, as we're going to be one of the main organizations to help emerge what's called the Accountable Community of Health here in King County, which is linked with healthcare reform and the state's work to integrate behavioral health, chemical dependency, and primary care, and develop a prevention agenda. So that's a big
just a
piece.
few items.
Just a few items.
In terms of public health, in the next 5 years, what, as we as a public, what can we expect to be some of the emerging issues that you see?
So I think that the continued work on how do we address the core issues that we know lead to shorter lives. This is the first generation where we're fearful that our children are going to be living a harder and not as long of a life as you and I are. I mean, that's an amazing statistic. So we have to be looking at what are the issues that we need to be addressing around that. Healthy eating, active living, but it's also about the environment. And we also know that climate change is coming, and public health has a core role as new emerging diseases happen. So you're going to see a range of things that public health will be talking about, and also working with communities to address specific needs there.
Patty Hayes, Director of Public Health for Seattle and King County. Thank you for being with us.
It's been a delight. Thank you.
And thank you for tuning in. Join us again for another 15 minutes. We'll see you soon.